Good morning. It's coffee time. Let me share with you some of the things that have come across my desk this morning. Let's start with this paper here. Very interesting about dietary supplements. These days a lot of people take multivitamins or they take vitamin A separately, vitamin E, coenzyme Q10, all kinds of supplements that people take. Well, the question is, can these possibly do any harm? Well, it turns out, as this paper documents, that if someone is undergoing chemotherapy or radiation therapy for cancer, then these supplements can actually be harmful. Why? Because those treatments gear up the body's production of free radicals, and those free radicals then attack the cancer cells. So you don't want to impede their activity. But that is exactly what antioxidants do. And in this paper, they document that. They had about 1,300 people who were unfortunately suffering from cancer. And they did a survey among them to see what they were taking. And of course, many of them were taking dietary supplements because that's a very common thing that people do. When they're diagnosed with some disease, then they start taking supplements, thinking that this is going to help the outcome. Well, what the researchers did here was to take a look at the patients who were taking these supplements and ones who were not, and check their progress and their outcome. And it turned out that the ones who were taking the antioxidant supplements fared more poorly. Okay, but how about some better news? This one here comes from some Spanish researchers, and they looked into wine. And they selected 9 nuns who lived in a convent, and they were cloistered. And this is a very good population to study because they have very similar lifestyles. Of course, it's not a very large study with only 9 nuns. But it turned out that these nuns had not consumed any alcohol, any wine, for about 2 years. And the researchers decided that they would have them drink a glass of wine at noon and a glass of wine in the evening. And for 2 weeks, they followed their biochemistry. And it turned out that the production of certain enzymes like catalase and a protein called SIRT1, these are associated with longevity. These are good things. And the production of these in the nuns increased. They then followed this up with a study of fruit flies. And they divided fruit flies, large groups, 300 in each group, into 2 categories. Some of these flies got the normal fly food. I'm not sure exactly what that is. And some of them got the fly food fortified with wine. And it turned out that the fruit flies that had the wine added to their diet had an increase in life expectancy that was about comparable to 7 years in humans, so pretty significant. Of course, the researchers don't say that this is a final study, obviously using only 9 nuns and fruit flies, but it's indicative that there may be some benefit in drinking wine. However, of course, there is a downside because we also know that alcohol consumption is associated with increased risk of breast cancer, increased risk of esophageal cancer. So you cannot make a universal recommendation. But of course, not everything in life comes down to evaluating every drop that goes into our mouth, if it's good for us or not. If you enjoy a glass of red wine, well, this study kind of shows that you don't have much to worry about. Let me also recommend a book to you, Chemistry for Breakfast. A very, very interesting book, and it is written by a young chemist. She lives in Germany and also has a podcast, and she does videos. Very, very good, and I really enjoyed this book. I was quite happy to make a favorable comment on the back cover about it, because what she does is go through a whole day of her life and talks about all of the chemistry that is involved. Many, many interesting examples. For example, she discusses how caffeine actually is similar in molecular structure to adenosine, and adenosine is a molecule that makes us drowsy, and caffeine, because its molecular similarity, displaces it from receptor sites, and gives interesting explanations like that. She talks, for example, about benzoic acid, which is found in all kinds of berries. I mean, I eat a lot of berries. Every morning I eat my blueberries. I get a big dose of benzoic acid. But if you listen to some of the alarmists, they will point at foods that contain sodium benzoate or benzoic acid as a preservative, because it's an excellent preservative against molds, fungi, and bacteria. But because then it is on the label as a preservative, people get all upset about it. Of course, the amount that is in there is very small compared to the amount of benzoic acid that we consume in the diet. This is certainly not something to worry about. Is it possible that some people have an adverse reaction to benzoic acid? Sure, it's possible. There are people who have adverse reactions to just about anything that you can think of. But this is certainly not an earth-shaking problem to see benzoic acid as a preservative in a food, especially given the fact that we consume large amounts of benzoic acid in our daily diet anyway. Also this morning with my berries, I like to have a piece of toast, and I do put butter on it, not much. I kind of show the butter to the toast, give it a little bit of flavor. But I dripped a little bit of butter on my pants this morning, and I got a stain. Well, I'm sitting here in the office, what do I do? And I do have some gall soap that I have around because I once did a video about this. And this contains bile acids from ox bile. And these bile acids contain compounds called sterols, which are very effective at removing stains. So indeed, I took it out, I rubbed it on my pants, and I wetted it, and it's drying right now, and there's no stain. So I can recommend this. I don't get any funds because I recommend it. I don't even remember where I got it, but you can look at up gall soap. It is very, very interesting. All right, so that's what I've come across this morning, and I will now continue with my coffee. And there are those caffeine molecules displacing the adenosine from receptors right now, and I already feel more alert. Have a good day.